So an emerging theme here at this meeting is the use of MRD, measurable residual disease, as a way to compare the effectiveness across various trials and potentially, and this has not yet been proven, to guide the duration of treatment within individual patients. So in the chemotherapy era, it was very clear that the deeper the remission, as measured by MRD, and the most informative cut point was at the level below 1 cell in 10,000, patients who achieved that deep level of MRD had a far more durable period of disease control. And in the frontline setting, attainment of MRD negativity was a necessary prerequisite to potentially open the possibility of cure. With single-agent BTK inhibitors or B-cell receptor inhibitors, they do not induce deep remissions on their own, and so temporarily the field believed the depth of remission did not matter. With venetoclax-based treatment, we're seeing depth of remission again restored as an important predictor of duration, and now that we're moving to combination treatment, either with venetoclax and antibodies or venetoclax and a BTK inhibitor, again we're seeing the relative effectiveness of regimens measured by what their MRD negativity rate is. So the field is now using that to compare regimens. The next step will be, can we use that in an individual patient? And the tension we have here is, how likely are we to deepen remission versus how likely are we to induce resistant mutation by prolonged exposure? And it's unclear where that balance may lie, and it may actually differ within individual patients. For example, those with a complex karyotype, or perhaps an unmutated IGVH status or TP53 mutation, some of the biology suggests that they may have a greater propensity to the development of mutations. Conversely, those with a more stable genome may get more prolonged benefit. So the challenge then is to work through the underlying biology of these different disease subsets to try and work out what is the optimal duration of treatment while minimizing the selection of resistant clones. So many challenges remain, but it's clear that the use of MRD will be an important tool to help us move the field forward.